Welcome to the Occupational Safety Leadership Podcast, episode 62. In this one, we're going to talk about OSHA standard when it talks about access to employee exposure and medical records. Let's just dive right into this episode. This standard can be found at 29 CFR 1910.1020, which is also known as access to employee exposure and medical records. So, according to the standard, employees and their designated representatives have the right to access relative exposure and medical records maintained by the employer. This includes records of exposure to toxic substances or harmful physical agents in the workplace, as well as any other medical records for work-related conditions. Also, when you think about things like physicals for respiratory protection and spirometer and all that other stuff. So this is just basically saying that you always have access to your records then. But there are a couple of stipulations. Let's get into those. So the first one, access to the records. Employers must have an accurate record of what you've been exposed to, along with how that you were tested, of course, and all that good stuff then. So has to have the identity of the substance or agent, exposure levels, concentrations, duration of exposure. Um, Basically, if you've ever had a industrial hygiene survey done on you, and it'll say we're looking for let's call it ammonia, So you were the sampling pump for 1 hour, and this is exactly what the level that came back with for a 1 hour exposure to ammonia. That will list the physical substance. That's going to have the duration. That's going to say here's your exposure. It's going to cover all those things then. So let's talk about access to medical records then. So employers must maintain accurate records of employee physicals, consultations, and anything else in there, which is kind of like a little catch-all then. So records have to have the employee's medical and work history, results of the medical test, written opinions from healthcare professionals. You can never go by anything that's oral so everything has to be in writing then. So, and you always have access to these. So let's talk about when you want access to this then. So you have to generally need to submit a written request to your employer. Request should specify the records which they wish to access and the time frames and why they're requesting it and all that. That's what the standard says. Anybody who ever asks for anything from me, I just give them everything right from the get-go because there's nothing to hide. We're not doing anything wrong. But I also get that companies have a different level of risk and the way they look at risk. That maybe they're only going to give you exactly what you ask for and not everything. So I can kind of see it a little bit of both ways. And to me, written means that you sent me an email. Where I also understand that some people believe when you look at the standard itself, written means that it has to be, actually in writing from the person. It then has to go to somebody in the management chain, and then they have, which then gets back to the time frame now for providing access. Then, so once the access has been provided, I should say once you've been requested access then. So employers generally have 15 working days to go ahead and get them that information then. So if access cannot be granted in that time frame then, so the employer should inform the employee of the delay and provide a estimated date for when they can go back and do this. Some of the old-fashioned paper records, of course, are only stored for so long before they're all transferred to a transfer place. So not that the employer doesn't want to do it, but they literally have to go find these things and then get them back to the person then. So for me, I get people access as quick as they possibly can because they're typically not just asking because they just happen to be bored and they're walking around and they come up with this. There's typically a reason why, and for me, I want to get them the access as quick as I possibly can, get them all of the records and data. But again, it gets back down to different companies have different levels of risk and tolerance and what they consider writing and not writing. OSHA has very specific things, but like all things, you just literally have to be able to find these records also then. And the confidentiality then. So the employers are required to protect the confidentiality of the employee exposure and medical records. Basically, once you take the file out, it needs to be you do whatever you got to do. You take it back, you lock it up, you make sure that nobody else ever has access to it, because you want to always protect that confidentiality of the person out there. If they choose to share it, well, that's a different story then. But you, as the employer, you have to do everything you can to protect their confidential medical records out there. That is it for episode number 62, access to employee exposure and medical records. This one was short and sweet one, but basically in a nutshell, if somebody needs the info, and really what this means is that they can't find their own records, because when you provide them a copy of either the physical, the spirometer, you're doing the industrial hygiene survey, and then you've gotten that info back to them. I get it. It's hard to keep all that stuff handy. It's hard to have it all archived on a personal level. It's always better for somebody to go back and just ask the company, I need the following records for my for my medical needs. We'll just call it then. So. Episode number 62, access to employee exposure and medical records, is over. My name is Dr. David Ayers, and have a safe day.